jumping on here. I think we've had over 110 people register. So as you are all jumping on, if folks could take a moment and just answer the question that hopefully you see on screen, that would be awesome. I will do the same. My name is Lori Frasina. I'm the Executive Director of Voices for Healthy Kids at the American Heart Association and one of the coordinators for the National Collaborative for Infants and Toddlers. I want to thank everybody for joining today. We have been really excited about this, and it's a really special opportunity here directly from the source and the experts about first focus on children's babies in the budget, which shines a light on the woefully inadequate funding our government places on infants. We're really excited to work with all of you to change that. We are hoping that there will be opportunities for you to put questions in the chat throughout this. We'll have some time at the end with our experts, but don't be shy about putting your questions into the chat as we go through this. There will be some materials we link to in the chat, and we will also follow up after and share those materials with you. And we will also make sure that this recording is uploaded into a shared site after, I think we do it usually within a week. There's a few housekeeping things I just want to go through because we got to always do the housekeeping. As I just said, the recording slides and links will be shared. You can use them with your organizations. We encourage you to do that. If you're not on mute right now and you could put yourself on mute, that would be great. There's a big group here, and if there's time for out loud Q&A, you'll have an opportunity to come off mute, but please do that. Sometimes you need tech support, as we know. Angeline Kitchens is the person who's leading all of that for us. So in your chat, you can send a note to her and she will do her very best to help you. And there she is saying hello. And if you want to ask a question, you can enter it in the chat or raise your hand, but we'll probably try to keep the questions towards the end of the program. So please don't think I'm ignoring you, but we're just trying to make sure that we can all hear the presentation and have ample time for questions and answers. I hope that sounds good to everybody. So we have just a quick overview of the National Collaborative for Infants and Toddlers. If you joined us today, you are a member because we support and promote all of these learning opportunities for the members of the National Collaborative. Our focus is really to be a nationwide movement around prenatal to 3 health and well-being and using public policy at the national, state, local, and tribal levels to drive change. That is done in large part through the member organizations that are part of this, including all of you and experts we work with. If you are not currently a member of the National Collaborative for Infants and Toddlers, both as an individual and an organization, we would love for you to sign up. You will get a QR code to do this. We will ask you multiple times to do it, but it really matters. And I think by the end of this, all of us are going to feel a little more fire in our belly to be contacting our own lawmakers about what we hear today and getting involved, and we'll certainly be weaving that throughout our work with the NCIT. So please join us. We would love that. And we are also happy to promote the work of your organization as we are doing today with the First Focus on Children team. So we have a real, I don't know, I'm very excited. I got to read all of their bios beforehand, and I'm really excited and impressed by the folks who are joining us today. So we will hear from Chris Becker first. Chris is the Vice President of Budget Policy and Data Analytics at First Focus on Children. Before joining First Focus, Chris was the Senior Economist and Associate Director of Policy and Research at Groundwork Collaborative. Chris also served as a research fellow at the Roosevelt Institute and the Southern Economic Advancement Project, where he helped develop a blueprint for a just transition away from fossil fuels in Louisiana. His previous academic research and dissertation focused on the economic history and political economy of the United States, with a particular emphasis on the U.S. South. He holds a PhD in economics from Stanford University, a BA in economics and BS in mathematics from Marquette University. He's originally from the northwest suburbs of Chicago, is a diehard Chicago Bears fan. Sorry about that, Chris. And cheers for the 2021 NBA champion Milwaukee Bucks. You can give us a wave there, Chris. Chris will be joined by his colleague, Avery Pikulis, who is also phenomenal. And I'm going to embarrass you, Avery, by reading your bio here, but I want people to know who they're hearing from and your depth of experience in the early childhood work. She is the Vice President of Early Childhood and Public Health Policy at First Focus on Children. Avery has over 15 years of public policy experience on Capitol Hill at the Department of Health and Human Services and in the nonprofit sector. For 4 years, Avery served as a policy advisor to Secretaries Sebelius and Burwell at HHS in the Office of the Secretary and the Assistant Secretary for Legislation. Just prior to joining First Focused on Children, Avery served as the interim legislative director for HHS at the National Governors Association. Her experience covers areas of public health and human services, including behavioral health, opioid addiction and recovery, early childhood care and education, women's health, family and medical leave, and child abuse prevention. Avery has worked closely with a number of public health and human service agencies, such as the Substance Abuse and Mental Health Administration, the Administration for Children and Families, and Federal Drug Administration, and the National Institutes for Health on agency regulations, programs, and grants. Prior to working at HHS, Avery served as the staff director and professional staff member for Senator Christopher Dodd from Connecticut on the Children's and Family Subcommittee on Health, Education, Labor, and Pensions Committee from between 2008 and 2011, which seems like a whole different world, Avery. That's a different webinar, where she led the successful reauthorization of the Child Abuse Prevention and Treatment Act and the Family Violence Prevention and Services Act. She also successfully worked to expand family and medical leave for family members of service members through a provision in the 2008 National Defense Authorization Act. And she worked for 6 years at the House of Representatives. You look way too young to have done all this, Avery. And in the personal office of Congresswoman Rosa DeLauro, also from Connecticut, helping with her lead her healthcare portfolio. Originally from Connecticut, she earned her bachelor's degree in political science from Union College in Schenectady and resides in Capitol Hill with her husband and daughters. And we have one more special guest joining us at the end for Q&A, who might be known to some of you. Bruce Leslie will jump on back and forth to respond to certain questions and chime in with ideas he might have for how we can all activate on this important data. Bruce has led First Focus on Children and its partner organization, First Focus Campaign for Children, since 2006 and 2009, respectively. Prior to that, Bruce worked on Capitol Hill for over 12 years for 3 different senators and 2 House members on the Senate Finance and Health Committees and on the Senate Special Committee on Aging and the House Energy and Commerce and Appropriations Committee. In the Washington, D.C. area, Bruce also serves as a head of Health and Human Services policy for the Texas Office of State Federal Relations and Director of Congressional Relations for the Children's Hospital Association. Did a lot of work here in Texas. I'm going to skip over some of that because you guys have done so much that I don't want to miss out on the conversation because these are incredible bios, but I want to thank Chris, Avery, and Bruce for being here today. And Chris, I'm going to turn it over to you to get us started.
Thank you, Lori. Thank you so much for having us. We're really excited to be able to present this work. Unfortunately, it's a little depressing, but it's important. So we're really glad to be able to share it with you. Okay, so what I'm going to be presenting is our results for Babies in the Budget 2024. And so this is a report, I think this is the 3rd time we've done it, where we are essentially trying to figure out of all the money that we spend in the federal budget, how much of that is going to infants and toddlers from the ages of 0 to 3. So conceptually, it's a pretty simple question. How much of the money in the federal budget goes to infants and toddlers? A lot of work goes into getting that number, but ultimately what we want to try to understand is, are infants and toddlers being made a priority in our federal policy decisions and in how we allocate money in the budget? We know there's a lot of things that we prioritize. We prioritize military spending. We prioritize protecting seniors. We want to understand, are we also prioritizing our youngest children who are in a stage of development where what we do to support them is essential to setting up the rest of their lives? And unfortunately, what we find is that we are not making babies a priority at all, and we are just woefully underfunding the programs that support their well-being. And unfortunately, it's actually getting worse over time. So in addition to just kind of our overall analysis, we're going to give you the headline numbers across the entire budget. We also have detailed analysis by issue area. And so we divide our programs into these 6 areas: early childhood, income support, health, justice and child protection, housing, and nutrition. And so if you go read the Babies in the Budget report, there's detailed breakdowns of each of those areas and the funding and trends in them, as well as a chapter written by our policy experts in these various areas who break down what trends and decisions are underlying the numbers that we find. So I would encourage everyone to go read, those details that I will only be able to scratch the surface of here. We track over 150 programs in our Babies in the Budget book. So, there are a lot of different programs across the board that support babies and across a lot of different departments, a lot of different agencies. And we're doing our best to get that comprehensive picture. Unfortunately, what we find is that we do not spend a lot of money on babies, despite that huge number of programs. We find that in fiscal year 2024, out of all of the federal budget, only 1.52% of that money goes to babies or babies and toddlers or their families to support their needs, to support their health, their nutrition, their early childhood development. Putting all of that together, less than only 1.52% of the money in the federal budget goes to those priorities. And unfortunately, it's getting worse over time. In fiscal year 2021, we got that number all the way up to almost 2%. Still not enough, but a lot better than 1.52%. And the reason for that is that during the midst of the pandemic and the recession that followed it, we had a lot of historic investments that disproportionately prioritized babies. We had an expansion of the child tax credit and its refundability so that the child tax credit could support the lowest income families. We had an expansion of the Child Care and Development Block Grant. We had economic impact payments that sent money directly to families. We had expansions of SNAP. And so there was more money available to babies and toddlers for their nutrition. We did all of these great things that helped people in general, of course, but disproportionately, these helped babies. And so we really showed that in 2021 and 2022, in our response to the pandemic, that we could provide for a somewhat better future for babies. And unfortunately, over time, we've unwinded all of those huge gains that we've made. The child tax credit expansion expired. The economic impact payments phased out. The Child Care and Development Block Grant expansion phased out. We recently had the phase out of the expansion of SNAP benefits and the emergency allotments. So we created a better future for babies very temporarily, and then decided to not do that anymore. And so you see that in the numbers going from all the way from 1.98% down to 1.52%, 3 years of steady decline since fiscal year 2021. I just wanted to point out that we have another report called the Children's Budget that tracks the same sort of progress for kids from 0 to 18, tracking all programs that benefit children of any age. And we basically find the same story. So we peaked in fiscal year 2021 at almost 12% of funding going to children, and that's declined all the way down to 8.84%. So even if you look at children as a whole, we're still under 9% of money going to support children, and the same negative trend shows up there too. Going to focus on babies and toddlers for today, but I wanted to point out we also have this report on children in the budget too. Okay. The other way we can look at trends in our funding for programs that support babies is whether they're keeping up with inflation. Because we know over the last few years, prices have skyrocketed. So we give money through these programs to support babies' nutrition, their health care, their all these needs that they have. But on the other end, families have to take that money and then spend it on these things that they need. And so if the price of food is going up, if the price of healthcare is going up, that money that they're receiving for these programs is not going as far as it used to. And so even if we were to flat fund these programs, and a lot of the programs are flat funded, that's really a cut because they're getting the same amount of money, but it doesn't go as far if prices are going up. And so we also compare the change in federal spending to inflation, and we find there a negative story as well, which is that the funding for babies is not, and toddlers is not going up fast enough to keep up with rising prices. And so when we adjust for inflation, we find that spending in fiscal year 2024 was 2%, decreased by 2.1% relative to prices. So again, that's the third straight year that this is the case. For 3 years in a row, our funding on babies has failed to keep up with the rising prices. And that's true even now as inflation has come down a lot. So luckily, prices are not going up quite as fast as they did at the peak of inflation, but still our spending is not enough to keep up with that. Okay. So when we look at what is going on in this decline that we find from fiscal year 2023 to 2024, what is the big driver of this decline in support for babies? And in this case, there is one huge driver that dwarfs everything else, which is the decline in SNAP benefits. So during the pandemic, we instituted emergency allotments for SNAP that increased the support, increased the money that was available to families to pay for to support buying nutritious food for their kids. And unfortunately, those emergency allotments expired in 2023. And so we see that in fiscal year 2024, there's a huge decline in the money that's available to families to pay for, to use for SNAP. And so if we estimate just the portion of SNAP benefits that were going to babies, we find just for our babies and toddlers, we find just for kids aged 0 to 3, there's a full $2.168 billion drop in federal dollars going to SNAP between 2023 and 2024, just for babies alone. It's much bigger if you look at children as a whole. And so that's a 24% drop adjusted for inflation. When you account for the price changes, they're getting a quarter less money than they were in fiscal year 2023 for a really essential program. And so, that is by far the biggest driver that we find. If we had just kept SNAP where it was, what we find is that babies actually would have had a very tiny increase in the in federal spending. So even if we had just kept the SNAP emergency allotments, we would have made a very small amount of progress. We'd have achieved basically flat funding relative to inflation. So SNAP is by far the biggest driver. And it's also really important to emphasize that this is really just the last domino to fall. The child tax credit expansion already went away. The Child Care and Development Block Grant expansion already went away. All of these other big programs phased out in 2022 or 2023. This is kind of that last domino to fall. So it's not just this $2.168 billion, which alone would be awful. It's 3 years of cumulative phasing out of really good programs that helped babies tremendously. I want to, especially with an audience that has a lot of advocates and who are on the ground fighting for babies every day, I do want to highlight a little bit of a silver lining, which is that it could have been a lot worse because what we see through the budget process in fiscal year 2024 is that there were some pretty sizable wins that advocates got within funding for babies or children from 0 to 3. And so in particular, we find that WIC spending went up by 14% adjusted for inflation. So unfortunately, we're seeing the SNAP benefits go away, or the increase in SNAP benefits go away. But at the same time, we got an expansion of WIC. And so there is this positive development that's somewhat compensating families for this loss of nutrition funding. They're at least getting more access to WIC funding. I do want to emphasize that increase is not nearly enough to make up for the decline in SNAP. It's still a huge net negative, but it could have been a lot worse if we hadn't had the expansion of WIC. There are some housing programs that also saw increases in their funding. Tenant-based housing assistance, project-based housing assistance, and homeless assistance grants all increase from fiscal year 23 to 24. Our housing policy expert is not on the call today, but I know she would want me to point out that this number might not be quite as good as it seems, because there is some evidence that over time, a lot less of this money is actually going to children. So it could be that even though we're seeing increased funding for these programs, it may not be the case that a lot of that is going to kids. We just don't necessarily have the data to be able to parse that out, but there's some reason to believe that that might not be quite as good as it looks. And then finally, there were some early childhood programs that we saw increases as well. The Child Care and Development Block Grant and Head Start both experienced increase in funding as well. So the overall story is very negative, but it is still the case that advocacy and taking and fighting for these small wins still makes a difference. So I don't want to be entirely pessimistic here. And then the other thing that we can look towards is the president's budget, fiscal year 2025. The proposal is just a proposal. It hasn't been enacted, but it points towards what could be a better future for children 0 to 3. We calculate that if the president's budget were to be implemented in full, it would be a $38 billion increase in funding for babies and toddlers. So that's a really big number. It would do a lot of good. And by far the biggest part of that is an expansion of the child tax credit, basically reinstituting what we had in fiscal year 2021 during the pandemic, making it fully refundable so that if you're a low income family, you can get the full child tax credit, because right now, lower income people get a smaller child tax credit. And then expanding the amount available for the child tax credit as well, the maximum amount available. So that's by far the biggest driver. It's $28 billion for just that one change alone, which is about 81% of the increase that we find in the president's budget. So this tax fight that is upcoming in fiscal year 2025, protecting the child tax credit and working to expand it is a huge priority when it comes to children 0 to 3. And then there's a lot of other good things in there too. We have the Affordable Child Care for America to support childcare, National Paid Leave Program, among other things you can see in that chart there. So the president's budget it's not, even there, there's a lot more we could do, but at least you can see a vision for what could be a lot more support for babies 0 to 3, or babies and toddlers. Okay, since we have a good amount of time here, I'm going to go into a little bit the issue by issue trend. And so it's a little bit of a mixed bag. We do find, if we look at the bigger picture from fiscal year 2020 to fiscal year 2024, we find that some areas we have a decline in support, and some we have an increase. It's important to note here that fiscal year 2020 was a bit of a low point. So our baseline is not in a great place here. And despite that, we still had income support and justice and child protection decline as a share of the federal budget. But housing, nutrition, health, and early childhood are still up from fiscal year 2020. So absolutely no way around that we're doing a lot worse than fiscal year 2021. But there's been, at the peak of our support for babies during the pandemic, but we're still doing slightly better in most areas compared to fiscal year 2020. So we are way below the high that we achieved, but slightly better than where we were in the recent past. I'll go back to that slide. So these areas, like I've been emphasizing, obviously there's been a huge decline between fiscal year 2023 and 2024 in nutrition. And you can see that there, we're down from 15 billion down to about 13 billion in terms of our spending level on children. But again, we are still up from fiscal year 2020. So we were at only about 11 billion then. So we've seen a slight increase within the nutrition space, just not as good as what we had achieved. So that's really the story there. We had a huge increase from the expansions of SNAP and some other programs. Those have gone away, but we're still up slightly. In terms of income support, we've seen a decline in that area. So again, huge peak in fiscal year 2021, largely because of the child tax credit expansion. There are a few other programs in there too that saw boosts, but then down in fiscal year 2024. And that number is actually a little bit down from fiscal year 2020. Health, this is one of the more positive areas. We are actually have seen a pretty steady increase in health over the years. So we are up from fiscal year 2020. We're actually up a bit from the pandemic era as well, or the peak of the pandemic. So that's great. A lot of that is coming from increases in Medicaid, and a lot of the maternal and infant health programs that Avery is going to talk about when I finish. Yeah, so that health is kind of one of our most positive areas that we track. Early childhood is also an area where there's some positive movement from fiscal year 2020. Again, same story, down way down from fiscal year 2021. And a lot of that is coming from a temporary expansion of the Child Care and Development Block Grant, which there was a huge expansion of in fiscal year 2021. That was only a 1-year expansion, so we went right back down after that. But we have seen a steady increase in this area since fiscal year 2022. So that's good news. We're up a bit. And the president's budget would really see a really big increase in this area in particular. So you can see it's almost a $3 billion increase within the president's budget. So this is one area where the president's budget does a lot of good, 30.66% increase, even relative to inflation, adjusted for inflation. So really good area for the president's budget. Housing, we've also seen a big increase since fiscal year 2020. There's another one where we have kind of steady increase over time. Now, two things to note. One, most of that increase occurred in the first few years there from fiscal year 2020 to 2022. Or sorry, 2020, but yeah, 2022. And it's been more steady, kind of flat since then. But it's still up a lot from fiscal year 2020. And again, I'll say the same caveat. We are still researching this and we're trying to find the data that we can use to get into this more, but we do believe that maybe the share of funding going to kids is going down over time. So again, the story might be a little overstating the progress that we've made, but we just don't quite have the data to be able to say for sure yet. Justice and child protection. Here is another area where we have actually made negative progress since fiscal year 2020. There is a large decline between fiscal year 2023 and 2024, and that's largely due to a decrease in funding for payments to states for foster care. Okay, so to wrap up, I think what this shows is that we are not making babies or children a priority in the budget process. Only 1.52% of federal funding is going to support the needs of our youngest children from 0 to 3. We are not doing nearly enough to set up those children for a happy, healthy, successful, fulfilling life. We know that interventions in those early years are critical to the rest of the lives of these children. So we're just not making them a priority relative to the huge need that exists. We've seen that this can be better. We've seen that the child tax credit, the increased funding for nutrition, increased funding for health, all of these things have made a huge difference in the lives of our youngest children, in their families, in the life that they're able to provide for babies and toddlers. And so we need to really focus on getting some of those wins back on the table and then building from there. Even if we were to go back to where we were in fiscal year 2021, there's still so many needs that are unmet. And so I just hope that these numbers can help just light a fire under people. And I know people on this call, of course, are already passionate about these issues, but it's really a really bad place that we're in terms of our support for babies and toddlers. That's all I've got. I'd love to turn it over to my colleague Avery, who is brilliant, and if you couldn't tell by the resume, like just a really huge expert, great expert in all of these issues, these policy programs that go into supporting children through early childhood and babies and toddlers. And she's going to go into some of our work on infant and maternal health. What are we doing to support mothers at, in the prenatal space, as well as when they're trying to take care of babies, in infancy, in this really critical time for their health and their development. So I will turn it over to Avery to go over that, our fact sheet on maternal and infant health and well-being.
Thanks so much, Chris. And thank you again, Lori, and for all of you for giving us the time today to share some of this work with you. And then, of course, we really look forward to hearing from you, what questions you have, what things you could share with us that you're seeing on the ground and how this can be useful. I do need to update my resume, I guess, my bio, because I now live back in Connecticut. So hello to anybody, anyone on the call is in Connecticut. A special hi to you. So this year, as Chris mentioned, we have done the this Babies in the Budget book we've done this 3 times. And this year, we had a special emphasis on infant and maternal health and well-being, working with some of our partners to make sure we're emphasizing the importance of supporting young families and maternal and infant health. And of course, as many of you and most of us sort of now well know, the numbers of the statistics on infant and maternal health and mortality in the United States are not where they need to be, and we lag behind a lot of other countries, which is surprising in a lot of ways, and maybe not in other ways when we look at things like how much money and federal money we invest in programs that help shore up infant and maternal health. So when we in this budget book, when we talk about infant and maternal health and well-being, we include sort of traditional health programs like Medicaid and other smaller discretionary programs, but we also included WIC, the Maternal, Infant, and Early Childhood Home Visiting Program, as well as the President's proposed paid leave program when we looked at his budget proposal. So just like Chris sort of did in his presentation, I will share some good news and then some bad news, and I think we can learn from both sides there. And the good news is that the share of federal funding for infant and maternal health and well-being, our research shows that it experienced a 39.7% increase between fiscal years 2020 and 2024. Most of this increase is due to Medicaid funding during that time. Obviously, Medicaid dwarfs a lot of the funding levels that we have for other programs, and some of that increase is due to during the COVID-19 pandemic, the continuous coverage provisions that were required and put in place. So that really helped keep a lot of kids covered and by Medicaid and receiving services that they needed. There were some other important infant and maternal health programs that also saw gains during that span of 5 fiscal years. And some of those include infant and early childhood mental health, the Vaccines for Children program, screening and treatment for maternal depression, as well as adverse childhood experiences, and then the maternal, infant, and early childhood home visiting program that I mentioned a minute ago, as well as the safe motherhood and infant health programs. But we did, and now I guess it's time for the less good news, the bad news. We did see the Maternal and Child Health Services Block Grant lose nearly 3% of its spending power in inflation-adjusted funding between fiscal years 2023 and 2024. And then the share of federal funding for infant and maternal health and well-being peaked in FY 2023 at 0.8% of the federal budget and has now fallen in fiscal year 2024 to 0.75% of the federal federal spending. So we see that infant and maternal health and well-being programs consistently receive well under 1% of the share of federal funding. And we know, based on those statistics I mentioned earlier, on infant and maternal health and mortality numbers that we see in the US, that level of funding is clearly completely inadequate to serve the needs of mothers and babies. So it's great that we are seeing possibly an increasing trend for some of those years, but we're still woefully below the level that's needed to make a really big dent in those numbers. So looking at the president's fiscal year 2025 budget proposal, we have a little more good news. The proposed budget would increase the federal share of spending on infant and maternal health and well-being to 0.78%, which doesn't sound that huge, but when we're talking about small numbers, small increase like that is a little bit bigger. This would include some positive increases to the Healthy Start program, which would see a $27 million increase over FY24 levels. That program is a really important signal, I think, because that program has been targeted by some in Congress, by the House Labor HHS appropriations bills for a couple of years in a row now for zeroing out. So it sends, I think, the budget proposal and then the Senate Labor HHS bills have sent a strong signal that the Healthy Start program, which addresses infant mortality, is a really important one that we have to continue investing in. The president's FY25 proposal would also require states to provide 12 months of postpartum coverage under Medicaid. States currently have that option, and most states have taken it up, which is wonderful. But the budget would make that a requirement under Medicaid rather than an option. And it would create a new optional Medicaid benefit to expand maternal health support services, including some focus on doulas and home visitors. The budget proposal would see a slight increase for the Maternal and Child Health Services Block Grant, but that increase is not actually enough to keep up with inflation. So that's, again, some mixed news there. And really importantly, the proposal would establish a national paid family and medical leave program. We know from research that paid leave policies improve outcomes for children and families, including improved child brain and language development, improved breastfeeding rates, reduced postpartum depression, decreased rates of intimate partner violence, improved immunization rates, and reduced infant mortality rates. So that, to me, those are pretty hard numbers to argue against, right? And so we would see this new national paid family and medical leave program that could add quite a bit of investment in some of those outcomes and for families and children. The proposal would also boost funding for WIC to $7.7 billion. And so, like I said from the beginning, it's a mixed bag here. I think we are seeing some important increases and recognition that infant and maternal health and well-being are priorities. But we have to keep, we hope that this tool, this Babies in the Budget book, can be used in a variety of ways, but certainly as we look to improve maternal and infant health, we hope that this can be a useful tool for all of you and for us to continue to push for that and say that, yes, we're making some important investments, but we need a lot more. So thank you so much for your time, and happy to turn it back over to Lori now.
Thank you, Avery and Chris. Chris, you started out by saying that this could be a little depressing, and you scored high on that level, but I think there's also a little phrase that I like to think about as advocates: get them mad, get them motivated, get them moving. I think you got us mad, and I think we're motivating. The moving part is something I'm hoping we can tap into actually our audience for some ideas, as well as the three of you. But there's some questions in the chat. There's other questions that I'm sure people will have and would love to, if you've had a chance to look at them. Bruce, I can see you've been monitoring it, so I might start with you because you've given some responses. There might be some follow-up, but I'd encourage people to put your questions in the chat or comments in the chat. And I'm going to put one prompt in just because I'm excited about the creative people we have on the line. Is I would love to know from advocates who are listening in, any tactics or creative or effective ways you have ever used a data point, like this particular data point of 1.5%, to just hammer home over time the importance of a particular issue. And I was sharing, I remember New Hampshire advocates a number of years ago when they were trying to get the state to have smoke-free work sites. They had everyone in New Hampshire was like, no, live free or die. It'll never happen here. That's not what we do in New Hampshire. But 67% of the voters in New Hampshire supported it, both parties. And we just had pins that just had a black and white buttons with a 67% on it in black, and wore them everywhere. And the question kept getting asked over and over again. And I feel like 1.52%, it is not even, I can't even get my head around it. So I would love advocates to just pop into the chat ideas you might have, or how we can, as a national collaborative for infants and toddlers, like run with this number and start bringing in resources that are, if not proportionate, fair and sensible and smart for the future of this country and for infants and toddlers. So that's my commercial. But Bruce, I'm going to ask you to kick it off because I know you've been monitoring this, and maybe you can answer Angela's question and some other things.
Yeah, I would say on Angela's question, which is a great question, is it there's a little cognitive dissonance because we know that there's been disenrollment in the Medicaid program in a lot of states. During the pandemic, there was because they declared a public health emergency, they didn't allow disenrollment in Medicaid and CHIP. And now that's gone away. So there's this process called unwinding, where in some states are being very careful about that and not really trying to keep kids covered who are eligible. And other states are doing not as great of a process, to say it gently, but we've been very disappointed in some of the states who have very rapidly disenrolled people, and actually even provided incentives to third-party payers to disenroll kids and families. And so in some cases, if an adult can be ineligible because they have different poverty levels that states cover adults in and kids in. And what the state does is when they see that the adult is no longer eligible for Medicaid, they disenroll the whole family, even though the children are still eligible. So that's a huge problem. And so is it reflected in our numbers? It's not completely reflected in our numbers because of this sort of lag in data. So and also other things are going on in healthcare, right? Because there's also inflation. So we do see a disenrollment in terms of the number of people, but we haven't yet fully, I think, gotten the numbers showing from the federal government, like a full year of this in disenrollment. So, but Chris may have other added thoughts on that. But with respect to your question, Lori, I think it's a really great one, and we've been really shy about saying it should be an exact percentage, but are pointing out that it really, we are shortchanging our kids and families, and so and one of the things I think, just for everyone to know, is it's sort of built in to the system. So the budget is set up so that some programs are built to automatically grow and they're mandatory, and those kinds of things. And most children's programs are not. So kids programs are sort of disproportionately just what's called discretionary, which means Congress has to fund them every year, whereas other programs are not. And you think about the tax code, for example. They don't have to reauthorize tax breaks. They don't have to reauthorize or fund to a specific amount every year, those kinds of mandatory tax breaks or spending programs. So, so I used to be on the aging committee, and so certainly Medicare and Social Security are mandatory programs and important programs. So no one here at First Focus is advocating for cutting Medicare or Social Security. But what we would say is it would be nice if programs like that, we did more of that for kids too. So, seniors have Medicare, kids have, for example, the Children's Health Insurance Program, which is temporary and comes up constantly for reauthorization, for example, and has expired at points. We would never do that to senior citizens. So that's one example. And then also the inflation is built into programs like Social Security, whereas like a commiserate program for kids would be TANF. TANF has not had an inflation adjustment since 1996. So those are kind of examples that sort of even the way the budget is set up is inherently disadvantages kids. So some of
The
what we need to advocate for is like changing the system. But Go ahead, Chris.
All I'd add on the Medicaid unwinding is I think what Bruce said is the main point about the lag in the data. It might start showing up, in next year's budget, or the year after that. We'll start seeing it probably. The two things I'd add is on the data side of it is that even though we talked about this expansion of Medicaid over time over the last few years, we have found in the last 2 years that spending on Medicaid is not keeping up with inflation. So the last couple of years of Medicaid funding haven't been quite such a positive story. And then the second thing is that we definitely expect unwinding to be a net, negative for, babies and toddlers, obviously. It's not obvious what it'll do to the share of spending going to babies and toddlers, just because it also negatively impacts non-babies and toddlers, non-children. So in terms of what it does to the share, it's a little more complicated. But obviously, just it's negatively impacting anyone on Medicaid. So that is in one of these states. So bad thing. How it shakes out in terms of the share is something we'll monitor. But yeah, we'll probably see more of that going forward.
I don't know if you see the piece in the chat from Phil about wanting to see country comparisons looking at federal appropriations for prenatal to 3 and birth outcomes. And if if there's a country you think would be most meaningful to policymakers here in the United States.
I'm happy to jump in on that, unless Avery or Chris, you guys. So I think that's an awesome question, and I would say that there was a study, and I think it was by Hillary Hoynes, who did a comparison of U.S. spending on children's programs, not specific to kind of the population we're talking about today of young kids, sort of general kids more generally. And we ranked as a nation like at the bottom in terms of investments in kids as a share of gross national products, or GDP, right? Or gross domestic product, I'm sorry, GDP. So, and she was making the case that, and if you look at, and she also kind of looked at some of the specific programs. So like we're the only country among the developed wealthy nations who don't have like paid leave, right? Every other country has a paid leave program. And so kind of like highlighting some of the failures. And I would point out one other example that I think is very specific to the kids we're talking about, and if you look at the child tax credit, for example, in most wealthy nations, they have what's effectively a child allowance. So every family gets X amount of money per child. Our child tax credit in this country actually phases in, which means that for the lowest income families, they may get no credit. And even up into middle class families, they may get only partial credit. And so who are those families? Well, one of those types of families is newborns and moms, because on average, a mother who delivers a baby from the time of conception through birth loses about 34% of income. And you all know better than I, all the reasons why that happens. So between pregnancy and childbirth, right, you're not working as much, and other reasons why you would lose income. You're also having increased costs during that period. And our child tax credit policy is such that we then give you a reduced child tax credit. That makes no sense. So it's even in those kinds of ways, there's an inequity and sort of a unfairness built into the system that, we really need to combat. So it's so kind of back to the share, it's really kind of looking at all the individual programs and saying, we need a paid leave program. We need a fix to this child tax credit and make it more fully refundable. Certainly don't penalize moms and newborns. That makes no sense. And those kinds of things. So those are, some examples, I think. But yeah, the Hillary Hoynes was the researcher.
Great. Thank you, Bruce. Chris, Avery, anything you want to add to that? Or to something else?
I'm okay right now with Lori. Thank you.
That's great. So for folks who might want to jump in with questions in the chat, or you can certainly come onto mute, off mute, feel free. It's been interesting. This was really great and yes, maddening in all the right ways. So thank you for pulling this together and doing it objectively. I did get on Microsoft's tool for the AI tool and just looked for sources about federal budget and spending on infants and toddlers. You'll be happy to know that your organization popped right up and that Microsoft is very sympathetic to our cause. And I also talked about getting involved with the National Collab because they asked me, what would you like to do about it? And I said, I'm going to sign up for the National Collaborative for Infants and Toddlers, and had all this very funny sort of AI conversation. It's interesting for those of you who don't know, but the National Collaborative for Infants and Toddlers, or NCIT, that's sponsoring this webinar has had for the last 2 years a national rallying cry around appropriations, federal and state, but federal being a primary focus. And it definitely gets to a point where I feel like we are so focused on a bigger piece of the pie as opposed to the bigger pie. And the NCIT, and I know lots of people feel that way, and there's so many great organizations across the country at the state and federal level working on real tax reform. With the Trump tax cut set to expire at the end of 2025, it feels like there's a huge opportunity for us that care about infants and toddlers to actually stake a claim now and not just be waiting politely in line, but really being comfortable, getting tougher about this and being organized. So I think having a bigger, stronger NCIT, having there be a consensus on what we should be asking for. Honestly, I don't expect you to do that. And I appreciate the sort of objectivity of the organization. But the NCIT can do it in a bipartisan fashion, because let's be honest, neither party has gotten this right in terms of its investment on infants and toddlers over years and years and years. When you go back, and Chris, thank you for going back and showing that this is not a new problem or a 10-year problem. This is a historical problem in this country. So I'd love folks thinking about, like, what are we doing about this? Like, what's the NCIT's game plan here? Because we've got the data. We can't pretend we don't know now. And if that's the federal picture, we know in many states, it's a much more dire picture where some of the inequities are even deeper than they might be spread across the entire country. So I am excited about this. I'm going to ask Angie once again to poke into the chat or somewhere the QR code or the link for signing up for the National Collaborative for Infants and Toddlers, and let folks know there will be a series of webinars coming up really following on this. I think y'all inspired a longer conversation. So thank you, First Focus. We'll be having a number of webinars on tax reform, which sounds super boring, but it is not. Tax reform is exciting. Tax reform is good for babies and families. It means more SNAP and more WIC and better Head Start and more access for folks to good health care and all of those things we all care about, without necessarily having to cut anything else of value, which is the zero-sum game we're also given by our lawmakers all the time, and we accept it. And I think we're hitting a point where we're not accepting it anymore. I'm really excited about that. So much respect for what you've done here at First Focus to just continue telling the story through good data and engaging us. And I hope you will challenge us at the NCIT to, like, take this and put it into action, both at the federal and state level, with paid leave, with all of the other things coming up. They're huge opportunities. So everyone can applaud you in the chat. I will give one last chance, Chris, Avery, Bruce, if you have any final words, but mostly just want to really thank you. We will get you this recording for all of this within 1 week, and you'll get some instructions on that from either Andrea Guarnero or Angie Kitchens from our team that sends all this good stuff out that got you to register in the first place. But thank you. You've given us a lot to think about. And for those of you that are unfortunately in the path of Hurricane Milton, we're all thinking about you and sending our best wishes that you and your loved ones fare well in all of this. But thank you very much. And I hope you all have a wonderful afternoon. Take care.